Good afternoon, everybody. My name is Dr. Laura Miller, and this is a training on COVID, safety and personal protective equipment, or PPE. We are recording this on a lovely Friday afternoon, May 8th in San Leandro, and hopefully we will be able to get it out to you soon. My name is Dr. Laura Miller. I'm the Chief Medical Officer at Community Health Center Network. Community Health Center Network, or CHCN, supports 8 of our safety net clinics in the East Bay. And I myself am a primary care internal medicine doctor. I've worked with Lifelong Medical in East Oakland since 1999. In fact, I did telehealth visits yesterday afternoon. So I am not deeply in the trenches, but I still am caring for patients. So we put this together a month ago for folks taking care of and working with homeless individuals, and we wanted to deepen it and also make it as up-to-date as possible. So that's why we put this together. So what are our goals for today? Our goals for today are to learn about coronavirus, or COVID-19, how it's transmitted, how it's passed from person to person, how to recognize the symptoms, and how to keep yourself and your clients safe. Information is constantly changing as the situation changes. We've had tremendous issues with supply chain on personal equipment, personal protective equipment, on test kits. There's been changing guidance, which in part is why we freshened up this PowerPoint today, having given it about a month ago. What is true today might change next week, so it's just very important to keep your eyes and ears open, and we will pledge also to get as much up-to-date information as we can. So what is coronavirus? You see this image down here. I think all of us have seen this image. It is based on an electron micrograph, a very detailed picture of the coronavirus. It's called a novel coronavirus because it's new. There have been coronaviruses known for a very long time. Along with adenovirus, they cause symptoms of the common cold, but viruses change over time, and this novel coronavirus, or COVID-19, that appeared in China in late 2019 has seen rapid spread. It is highly contagious and also can cause severe disease. So the virus is called coronavirus. The disease is called COVID-19. Again, it was first detected in Wuhan, China in late 2019, and there's been rapid spread. The World Health Organization declared a pandemic on March 11th of this year. A pandemic simply means a widespread epidemic. And an epidemic is, of course, an outbreak of disease. So when we have a pandemic, it means that it has worldwide spread. And it causes a variety of differences in severity of disease. 81% of people may have a mild illness, not requiring hospitalization. They still feel really rotten. It is quite challenging with cough, with fever, with headaches, with body aches. But when we say mild, what we really mean is not requiring the hospital. Some 14% of people have severe disease and will require oxygen, and will need to go to the hospital for that. And some will need critical care or will need to be in the ICU. That's about 5% of people. The overall case fatality rate is 2.3%. So what that means is for every 100 people, 2.3 would die of the disease. And of course, the fatality varies based on underlying illness and risk factors. So how does it spread? There is a lot of controversy about this, whether it is droplet or airborne. it does seem that the consensus is falling on the side of droplet spread. So when we cough, here you have a picture of a person and their lungs. When we cough, particles spew out of our mouths. And the harder you cough, the further they fly. Um, Droplets are actually bigger than aerosols. You can see here on the bottom of the slide, droplets travel only about, half this distance, whereas aerosols are smaller particles and they travel farther. And this is really how one person transmits it to another. Measles is aerosol for sure, and that is very easily spread through aerosols. But one of the challenges around COVID is that it is droplet spread, and these droplets fall on surfaces, and it can remain viable on a surface for hours. So they can live on surfaces. So this is why we're going to emphasize a lot about cleaning surfaces. And then how do we get infected with COVID? Well, certainly you could be very close to a person and breathe it in, but also one of the common ways of spread is touching surfaces. So we would touch a surface, forget, and then scratch our face, rub our eyes, rub our nose, and that is how we could infect ourselves from a surface. We have what are called mucous membranes. What that means is, so my skin is relatively impervious. Not much gets through. But my lip, the inner part of my lip, the inside of my nose, my eye, like when I pull down my eyelid, those are all mucous membranes, and they're much more permeable. It's easier for the virus to get in to the body that way. And that's why we've emphasized from the very beginning, don't touch your face, don't touch your face, because it's much more easily transmitted by we can get it easier through the mucous membranes on our faces. So what are the symptoms? And I think as time has gone by with COVID, we have really realized that it causes a greater variety of symptoms than we first thought. In the early days of this pandemic in March, we were screening people for fever, cough, and travel from Wuhan, China as our testing criteria. Well, we know it is community spread. It's everywhere now. So travel from Wuhan, China makes no sense as a screening question. And I think we're much clearer on the variety of symptoms that it causes. So indeed, it does cause fever, but fever is not always prominent in the early days, and it can be from 45 to 90%. And that 90% is 90% of people who require hospitalization do have a fever. Fatigue is very common. People will get a dry cough. And when we say dry cough, we mean just that. And a wet cough is where people are bringing up sputum, bringing up loogies, phlegm, etc. So in COVID, it tends to be a dry cough. Loss of appetite in 40% of people, just don't feel like eating. Muscle aches. As all of us who have had the flu know that you get muscle aches. The muscle aches with COVID are really intense. 31% of people will become short of breath. 27% do have sputum production, so that's the wet cough that we talked about earlier. And then it's become clearer and clearer as we've gone through this that anosmia, or lack of sense of smell, is also a characteristic of the disease. So if people say, yeah, I used to be able to smell the frying onions, a week ago, and now I can't, that's something that we will really sit up and take notice about because it is now a recognized factor in COVID-19 illness. GI upset happens, definitely nausea, diarrhea, the lack of appetite is part of that. So that's something else to look out for. And again, as I alluded to earlier, just not having a fever doesn't mean you don't have COVID. So that's like a triple negative. But I think the bottom line is fever happens, but you could absolutely still have COVID and not have a fever. So we have to look at a broad variety of different symptoms and try to put it together. Risk factors that make it worse. And this means that the course of disease is worse. A person is more likely to end up in a hospital, more likely to need oxygen if they have these risk factors. So older age, we know that the disease can affect people of any age, but if folks are over 65, they are more at risk for severe disease. It does seem to affect children a lot less, but we're now learning about children who are affected, and there may be some link with a somewhat rare disease called Kawasaki's disease. That's just coming out from studies in New York City. So children are less affected, but we still need to keep our brains aware of what's going on with children. If folks have heart disease, like having had a heart attack or congestive heart failure, having had a heart surgery, they're more at risk. Diabetes makes people more at risk, and that is in part because diabetes suppresses the immune system. People's immune systems aren't as strong because of the effect of the diabetes, and they can't fight the disease as hard. A high blood pressure itself is a risk factor. Chronic lung disease and emphysema. You'll also hear the word COPD, chronic obstructive pulmonary disease. Those are associated with smoking. Folks with those diseases are at higher risk. Cancer certainly increases risk, especially if somebody is in active treatment for cancer. They would be on chemotherapy and immune suppressed for that reason. So again, immunosuppression is a risk factor no matter how it came about. Chronic kidney disease, immune compromise, and extreme obesity, all those elements are ones that we have found are related to people having a worse course with COVID-19. And also it is becoming incredibly clear that socioeconomic factors, race, ethnicity, zip code, are all associated with the disease. It's been said that your zip code is more important than your genetic code, and that is absolutely true. This is a map from Alameda County. I pulled it on the morning of May 8th. It shows cases per 100,000 population. The darker the color, the more cases. So you can see almost nothing up in the Berkeley Hills. And if you look, this is essentially our 580 corridor through here, East Oakland, Fruitvale, etc. High numbers of cases. It's absolutely becoming incredibly clear, and COVID is shedding a stark and bright light on healthcare disparities that we have known about and have worked against for a very long time. This is simply more data to show that. And I really applaud the county for putting this out by zip code. There's also race and ethnicity data on the dashboard. So again, really, really important things to know about. There was a study done recently in New York City looking at healthcare disparities. And essentially they found that the New York borough with the highest rate of poverty, which I believe in the study was Brooklyn or the Bronx, the borough with the highest rate of poverty and the most diversity had the highest hospitalization and death rates, whereas the borough with the highest income, and that was Manhattan, had the lowest. Even though they are similar in density and age, they are different with regards to poverty, race, and ethnicity. So again, we are seeing this all over, and one of the things that we are trying to do in Alameda County is focus our efforts such that we can make some of these disparities better. So flipping back to the more granular, to the right here and now, in working with your clients, ask them about symptoms. You would want to ask about fever, cough, shortness of breath, sore throat, headache, GI upset. And the GI upset can be minor, like nausea, lack of appetite, etc. Have they had contact with people who are known to be sick with COVID? Again, for our homeless population, keeping distance can be incredibly hard. You know, we are we are supposed to shelter in place in our homes. Well, if you don't have a home or your home is a tent, it's pretty hard to do that. Um, I had mentioned lack of appetite and also that lack of taste or smell. Really important things to ask about. And there are clearly certain things that are medical emergencies. And the absolute right thing to do is to call 911. So if people have difficulty speaking in full sentences and can't catch their breath, absolutely call 911. The same with chest pain and also confusion. One of the things that we know is that with COVID is that people can have very low oxygen levels and not really notice it that much. They're not obviously feeling short of breath, but the low oxygen levels can cause confusion. So definitely something to be aware of. Um, absolutely. So all of those would be reasons to call 911 to get somebody to a hospital rapidly. So we're going to flip now to taking care of yourself when you are taking care of others and talk about when going from home to work and from work back to home, and how to be safe at work. So when you are leaving home, you want to want to make yourself completely clean. Wash your hands, your arms up to the elbows and wash your face. Put on clean clothes right before leaving home. Oftentimes scrubs are helpful. They're simple. They don't have a lot of doodads and flowy things. And also for most people, they're very clearly a work related clothing item. So you're not seduced into keeping it on when you get home. Um, but no matter what, keep your work clothes and your home clothes separate. If you're not wearing scrubs, wear a shirt that's short sleeved or can be rolled up to the arms, and you don't want any scarves or flowy clothing because it's just going to drip, fall onto surfaces, fall onto people, and then be on you. It's not a good idea. So think minimalist. Think very stripped down but covered when you are out doing your work. You want to minimize the number of things that you take with you. Consider taking, driver's license, credit card, ID in a pocket with a little bit of money and just having it in your pocket. If you bring your lunch, think about bringing it in a paper bag or a plastic bag and just throwing that away when you get there. Because the more you bring things in and out of your home and your outside environment, the more likely you are to bring things into your home. And you do not want to bring COVID into your home. And you want to clean hard surfaces before leaving home. So we recommend disinfectant wipes, alcohol pads, or soap and water before you leave the home. So things like your phone, purses, lunch bags, etc. And again, I do think a disposable lunch bag is a great idea, as well as just completely stripping down your wallet and only bringing the bare essentials. It just leaves less to worry about. So at work, there's a bunch of different things that are now simply what we need to do in the workplace. Um, Maintaining a distance as much as possible. So we talk about the 6-foot minimum, and really that minimum comes from the difference between the aerosol transmission and the droplet. Droplet tends to go out and drop. Aerosol goes long. We do think COVID is droplet and that 6 feet is safe. However, the world is not perfect. We cannot always be a 6-foot distance from people. So it's important to cover your mouth and nose. So wearing a surgical mask when you're not eating. And we will talk later. So wearing a surgical mask when you're not eating. We will talk about surgical masks later. It's this simple paper mask. We have a good video on how to use it. It's pleated, it opens up like this. And actually, since we did this presentation the first time, masking in public is now required. So, you know, and the whole phrase of my mask protects you, your mask protects me, we're getting more used to that as a society, and keeping those droplets close to us, our own droplets, and giving us protection against somebody else's. So wear a surgical mask when you're not eating. Wear gloves if you're touching a client. Wash your hands frequently for 20 seconds. We've talked about singing happy birthday. You can sing anything you want, but definitely wash for 20 seconds. And this cartoon is maybe helpful. It's the idea of it is to get every single surface of your hands. So you want to do this, the snickering villain, getting the palms. You want to do this. Okay, so spiders on piggyback. Okay. Then you want to do spiders kissing. I don't know who made this up, but it's bizarro. Maybe it'll help us remember. Then you want to do the kung fu grip, rubbing the backs of your fingers. And then motorcycle throttle, doing your, rubbing each finger. Okay, because you really want to get all surfaces, both sides. And then mortar and pestle, scrubbing those fingertips against your palm. So that's a way to get every single surface of your hands clean. Think of it as if you were spreading paint on your hand and you wanted a completely blue surface. You would do it that way, just every single surface. And the friction really helps too. So think about all those things. Then you want to use a single-use towel, use a paper towel, and then throw it away and let your hands air dry. Certainly wash your hands before eating, and when at work, keep food separate from areas that might be contaminated. You want to frequently disinfect high-touch surfaces that include phones, keyboards, computer mouses, pens, badges, door handles, and other high-touch areas. Certainly for doors, if you possibly can, it's a great idea to open it with your elbow. If there are push pads on doors, great to do it with your elbow. And you can use a little electronic pad, alcohol pad for electronics. And then it's really important to wipe down and disinfect commonly used surfaces when you're in a setting with a lot of people. And we'll talk a little bit more about surface cleaning and about food handling later on in the demonstration, later on in the PowerPoint. So how to wear a mask. First, you're going to want to clean your hands with soap and water or hand sanitizer. A word on hand sanitizer. It's great stuff. And if you have soap and water available, probably better to use that than hand sanitizer. It's just more effective. Hand sanitizer is great if it's your only option, but definitely use soap and water is fantastic. So you want to take the mask out of the box, make sure there are no obvious tears or holes, and then you want to determine which side of the mask is the top. When you look at a mask, it's got a bendable wire on the top surface. That is to help it shape to your nose and prevent gaps, okay? So that's the top. And usually the side with color is outside and the white side, the lighter side, is facing you, okay? And then you want to follow the instructions essentially, and we have a video on this, so you're not relying on me. You want to loop it around the ears and then mold it to the nose and pull it so that it's over your mouth and chin. But we have an even better than me video.
Sam's patient has an upper respiratory infection. Sam knows what to do. Sam puts on a mask and enters the room. Sam? performs hand hygiene. Sam secures her mask either with ties or by placing elastic ear loops around her ears. She fits the flexible band to her nose bridge, making sure it is snug to her face and below her chin. Sam knows her front of her mask is contaminated. Sam performs hand hygiene. Instead of touching the mask, she grasps the ties or elastics of the mask, carefully removing the mask without touching the front. Sam discards the mask in the waste container. Sam performs hand hygiene. Great job, Sam.
And this is just words that describe what we just saw. When you're taking off the mask, you want to clean your hands with soap and water or with hand sanitizer. And avoid touching the front of the mask. That front of the mask is contaminated. So you would grab it by the loops, take it off, and put it in the trash. Then clean your hands with soap and water or with hand sanitizer. That's the appropriate way to do it. So this is from UCSF, when UCSF asked that all staff and all visitors, anybody in their institutions, wear a mask. So essentially, the mask should always cover your nose and chin. I see people walking around with masks on their chins, masks on their heads, masks on just their mouth. It's got to cover the nose and mouth or else it's useless, okay? So definitely it's got to cover both. It shouldn't hang off the ears or anything like that. And definitely using that wire to get it to fit appropriately is good. And if you wear glasses like me, the better fitted it is, the less fogging you're going to get on your glasses. Take it off if it becomes wet or soiled. Some are recommending that we can store masks safely if planning for another shift. Certainly getting rid of the mask at the end of the day. You've got to take it off for eating and drinking, that's clear, but try to avoid touching it as much as possible. And we talked a little bit about the inside and the outside. Usually the blue is outside, so definitely have the blue facing out. And then clean your hands after touching the mask. So gloves, we are recommending that folks wear gloves if they are touching a client. If you are not having touch contact with clients, it is okay not to wear gloves, but being super aware of your surfaces, your environment, and washing your hands frequently, and cleaning surfaces frequently. And again, we'll talk more about what surfaces to clean and how. So we're going to talk a little bit about taking off gloves here. Let's wait a little bit on the video. So how to take off gloves. So imagine that you have both hands gloved. Okay, you don't want, and they're dirty, right? Imagine them being contaminated. You don't want to get contamination onto your skin. So with your left hand, which is this one, you would pull off the glove so that your gloved fingers would be touching the glove and taking it off. And now this hand is ungloved. You would sneak skin to skin underneath and get off that other glove. So that's the beginning of a description. Think glove to glove and skin to skin, and we'll watch the next video. He does a better job than I do.
Now let's take a closer look at proper glove removal. Remember that only skin touches skin and glove touches glove. And if we follow those principles throughout this step, even if you forget the exacts, it should keep you safe and protected from any kind of cross-contamination. When we're taking off the gloves and they're contaminated with either blood or other potentially infectious materials, we're going to grab close to the cuff of the first glove and pull it away from the hand. Slowly untucking and unpeeling that hand away from the other gloved hand, we wad that dirty glove up into the palm of the gloved hand. Now, following the skin-on-skin rule, we go underneath the first or the second glove and untuck that. which keeps the contents on the inside clean on the outside. We can now dispose of this in a regulated waste container and then move to our next step, which is equally as important as the personal protective equipment, and that's washing our hands properly.
So now we're going to talk about how to get ready to go home at the end of the day. So you would want to take off your gloves, take off your mask, wash your hands, arms up to the elbow, and wash your face. Then disinfect everything that you've had with you that's on its way home. So that would include things like purses, lunch bags, binders, phones, laptops, etc. And then wash your hands again. Essentially, what you're trying to do is get as clean as possible leaving the work environment so that you don't bring anything home. Again, I think this goes to bringing as little as possible. Really strip it down. Really strip it down. Don't bring a lot of stuff. If you can change clothes at your workplace, that's fantastic. You would want to take off your work clothes, put them in a plastic bag, close that up, put on your clean clothes, also taken from a bag, and wash your hands again. Put those clean clothes on to go home and then leave. Don't sit back down, don't lean up against surfaces, put on your clean clothes and leave. So when you get home, you would want to clean the surfaces of your car as well, such as the steering wheel and radio buttons, etc. Now, you've gone into your car with clean as possible hands, but nothing is perfect, so this is an added level of protection. If you're going on public transport, definitely clean surfaces of anything you might have put down in public transport, like your backpack, a purse, lunch boxes. If you can't change clothes before leaving work, when you get home, immediately change clothes upon getting home, before hugging family members, before sitting on furniture, etc. Consider changing clothes in an open air space or a garage. I did a shift, I got home, I took everything off on the back porch in the dark of night, went inside and ran into the shower. So those things are absolutely good to do. You can take your work clothes and put them in a plastic bag, or you can also put them straight in the washer. And then you would want to really shower and wash your hands again. I mean, you're washing your hands in the shower. If you did change clothes at work, once you get home, put that dirty clothes bag in a designated area. If you're building up laundry to wash, or simply throw it right inside the washer. You absolutely can wash clothes that have been out in the world with other things. The soap, the hot water takes care of it, but you want to avoid having clothing or anything that has touched surfaces outside touch inside your home. So in keeping everybody safe, yourself and your clients, these things help. Disinfect surfaces around your home and around work. Wash your hands for at least 20 seconds. And if you sneeze or cough, cover your mouth. This is actually old. It really should say things like mask. And again, that's an example of how things have changed since we first started dealing with COVID-19, in that now we have a universal masking order in place in Alameda County. So absolutely, if you sneeze, cover your cough, cover your mouth, but hopefully if you sneeze, you will be wearing a mask. We're going to spend a little bit more time now talking about surfaces and how to clean, because that's come up as an issue. So in terms of when you are cleaning, it's important to wear disposable gloves to clean and disinfect. You want to use soap and water first and then a disinfectant, okay? Soap and water reduces the number of germs and dirt, and then disinfecting kills those germs. We talk a lot about routine cleaning of those frequently touched surfaces. So the more it's touched, the more it should be clean. In public places, things like shopping carts or keypads should be cleaned. In offices, any sort of communal space, in congregate living, any sort of space that, you know, a lot of people touch. So countertops, tables, etc. And then, you know, look around, see what it is that people are touching. High touch surfaces include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, etc. You know, just take a look around and watch what you are doing, watch what other people are doing, and then have cleaning be associated with that. You know, we mentioned disinfectant prior. So this is a link to registered household disinfectants, and we'll have that for you, okay? And just, you know, following labels is really good. It's also important to wear gloves and make sure that you've got good ventilation. Some of the disinfectants can be irritating to people, especially people who have heightened sensitivities, so it's important to be aware of that. You can also use diluted household bleach, and there are a number of recipes for that. And here it is here. To make a bleach solution, you can add 5 tablespoons to a gallon or 4 teaspoons to a quart. And that will be effective for up to 24 hours. So all of those things are really good to know. And again, reading labels is really important. So if something is past its expiration date, definitely don't use it. Get something that is not expired. And then for soft surfaces like rugs and floors, you would want to clean those surfaces using soap and water, or cleaners that are appropriate for that use. And then laundering items. We talked about the work clothes. Use the warmest possible water setting and dry them completely. This is where using a dryer, if you've got it, is not a bad idea, because it does heat things up and cook things such that it is we can kill the virus. And again, there's this link to disinfectants. This is actually off the CDC website and relatively easy to Google, but we'll try to add that list of disinfectants as a handout for this training. And then for electronics, you want to be careful with how you clean electronics. A whole bunch of soap and water is not a good idea for an iPhone, but you want it, you know, use alcohol wipes can be good, or sprays containing at least 70% alcohol, and dry those surfaces thoroughly. So for food handling, you know, clearly we want to have the hygiene of the folks doing the food prep be absolutely as good as possible. So they should be masked. They should frequently wash hands. And then the days of the single soup pot and the potluck and sharing are suspended for now. It's really important to have single package use and not be sharing food. So things like cups, plates, all of those things should be single-use items. Not great for the environment, but for right now, it's what we've got to do. And definitely in a food handling setting like a restaurant or a communal kitchen, increasing the frequency of cleaning and sanitizing, according to that CDC guidance that we had said above. So that is the end. Do we have a next slide? The most important part, gratitude. Thank you all for what you do. It's important to stay safe and take care of all in our community. I believe we'll have a time for questions, but I wanted to just give a huge shout out to all of you doing this work for the most vulnerable in our communities. It absolutely matters. We see you. I thank you. And another shout out for all the folks who have helped with this preparation. The Alameda County Care Connect Skills Development Unit, the SDU, has been preparing materials for Alameda County Care Connect for several years now. And with COVID, they just pivoted, jumped, and have brought you trainings. And this is one of those. So the SDU is a partnership between Community Health Center Network and the Pacific AIDS Education and Training Center, PAETC. Also awesome humans. Thank you so much.